Your clinic is in Bangalore.
Yes.
So is it like, but you do majority of work online.
Right.
How that exactly works? Like all your root cause analysis, everything can happen online, right? Like I don't need to send a patient to Bangalore if I need to refer.
Correct. So now it takes a lot of time for us to analyze the child.
True.
We don't want a parent traveling all the way to Bangalore and then I see them for a few minutes and then send them off. Doesn't make sense. So all the testing we try to have arranged home sample pickups.
Okay.
One is the blood test where we use some labs, existing labs. The guy will go home, pick up the sample. Then some testing is kit-based test, organic acid, microbiome testing, or some genetic testing, or some hair testing. The kit will go home. The parent will put the sample into it, then prepare it, and it goes to lab.
Correct.
Then we have enough data about the biomarkers. Then we send them a Google document to capture all the problems of the child. Now, I cannot ask 100 questions, and the parent might not be knowing 100 answers right away if I ask them. But I give them enough time. It takes 1 hour, 1.5, 2 hours. They can analyze all the problems of the child, and they are with the child. They know all the problems of the child. They give me the data, what are the problems the child is facing. Then I combine this data. I put the data together. These are the markers, these are the problems. And then we come up with the potential reasons behind it. Is it the mitochondria? Is it the infection? Is it toxin? Is it liver not doing okay? Is thyroid not doing okay? Is some of these children have diabetes also, by the way. Wow. They're metabolically poor. But because they have a diagnosis, nobody cares about that. So we try to analyze what is wrong, and then we step-by-step manner we come up with the action plan. Dietary modifications, lifestyle modifications. If infections are there on the test, then how do we clean them out slowly, gradually? What kind of probiotics to be used? Then if toxicities are there, we start with the baseline basic nourishment in the body, improving liver, etc. Then if required, we do chelation. Okay. Next level, now we are using a little bit of a regenerative medicine also, where something called peptide therapy. So peptides are sort of signaling molecules. They can these are biosimilars. The body is producing these peptides already, just like insulin. But because of the disease, because of the disorder in the body, probably the amount of peptides produced by the body is not enough. Thereby repair regeneration is compromised. So we can use to strengthen the immune system, to strengthen the gut function, to strengthen the brain health. So these different peptides are available. Then sometimes we can also use a little bit of a regenerative medicine, so cell therapy. We can use exosomes secreted by the stem cells. We can inhale them, nebulize them. They send the signals to reduce inflammation in the body and do a little bit of a repair work also.
But so that cannot happen at home. So
nebulization can happen, but if we have to do injectables, then we have to take them to ICU setting under a pediatric doctor guidance, and we can do that. So basically, we cover a whole spectrum of things, whatever it takes. Some they start seeing results with the baseline food, lifestyle. They start seeing, but some we have to go next step, some another step. So whatever is required, we do that to bring the child out of the problem.
Okay, and online it's majorly like even 90% of the things are possible online. So nothing should stop us if we are I think every parents want their child to be perfectly, live a healthy life and happy. That's more important. If the child is suffering somewhere, it's not able to adjust, then it's important that you reach out to a right doctor. And I always appreciate functional medicine way of dealing with the chronic conditions. Root cause analysis, I think today if I want to do that course, first thing I'll do is to do that course, after my MD if I want to. So I really respect the way you try to solve the problems. It's very tough for other professionals or normal people to speak anything about medical profession. But I personally, I'm a pharmacologist, I'm the drug maker. So, but still I feel that looking at the way, this prevalence is increasing and we are sitting with diabetes overload. We are talking about every child and every parent is saying that, okay, either my child have ADHD or some kind of a thing. It's very important that we look at the way functional medicine approach. We look at the root cause analysis. We look at taking our nutrition seriously and sleep and earth and water and very, very basic things. And I always appreciate whatever you do. And thank you so much for coming and discussing about anything. Any message that you want to give it to our audience who will be listening?
Right. So, autism or similar problems are not supposed to be lifelong problems.
Yeah.
If we work hard enough on them with the right practitioner, with the right approach, for a long enough time, sustainable efforts, the child can come out of it.
Yes.
Okay. It's not impossible. It is tough, not impossible.
Yeah.
You should be ready.
Yes. And we are calling it as a recovery, right? We can recover.
Yes.
Autism as a condition.
So let's say, just to last thing for the parents, the repetitive behavior, communication, and socialization. These are three things typically the hallmarks. Now, if we improve hormones, especially oxytocin, okay, as we improve the microbiome, the oxytocin production will improve. Then socialization will improve.
Okay.
Out of the 2 things are gone, that means half of the diagnosis is gone. And communication, if I improve the brain health, the speech centers are improved, then language communication is just an outcome of that.
Correct.
Right? As we improve the neurotransmitters, repetitive behaviors will also get better. If we solve this complex problem, break them into 3 parts, one by one I solve it, then there's no more diagnosis.
True.
Then we can say it is recovered.
Correct. Yes. And no, we should say that. Though I don't think that it's written in our textbooks.
Yes.
But there is no harm in saying that. And you have already treated so many children. You are helping so many parents. You have the data as well.
Yes.
And we have the results as well. So why not to say that? So I'll be very happy to say that it's possible to recover autism.
Yes.
And many more learning disorders.
Absolutely. Absolutely.